Hey everyone, welcome back. We are jumping right in today because we've got a highly interactive and practical explainer for you. We're going to walk through a real-time health challenge based straight on some fascinating source material regarding one of your body's most vital organs. I want you to get ready to actually participate with me because we are going to put your health to the test right here, right now, in literally 30 seconds. Do you ever wake up feeling just completely wiped out, like a heavy exhaustion that simply won't budge, even after a solid night's sleep? Or maybe you're dealing with constant stomach bloating, poor digestion, or you've noticed that your skin and eyes just kind of look dull lately. If any of this sounds familiar, you need to pay close attention. Our modern lifestyle, and we're talking all that takeout, fried food, and crazy amounts of hidden sugar, is quietly taking a massive toll.
80%. Seriously, let that sink in. We are doing this explainer today because the source material points out something absolutely mind-blowing. Your liver will rarely complain or show any obvious symptoms until it is up to 80% damaged. I mean, that is a terrifying statistic, right? Most people are walking around with absolutely no clue their liver is struggling until it's almost too late. So the big question is, how do we catch this before we hit that dangerous 80% mark?
Okay, let's dive right into this roadmap. First, we'll talk about the silent soldier. Then we're doing 4 quick physical tests: the rib press, the stomach vacuum, the mirror check, and the wall sit. And finally, we'll cover regeneration. Section 1. The silent soldier inside you. So before we start testing, we've got to understand what we're actually looking at and why it's absolutely crucial for your daily energy. Think of your liver as your body's silent soldier. Day in and day out, it's working overtime, filtering your blood and neutralizing toxins to keep you healthy. But here's the catch. It doesn't have pain receptors like other organs do, so it just kind of suffers in silence. Every single time we load up on junk food or refined sugars, we're putting extreme pressure on this unsung hero.
All right, Section 2, test number 1, the rib press.
Let's actually physically find your liver right now. If you follow the animation here, you can see exactly how to do this. First off, stand up totally straight, or just lie down flat on a hard surface if that's easier. Your liver is tucked away in the upper right side of your belly, just under the ribs. Go ahead and take 2 or 3 fingers and place them right below your bottom right rib. Okay, got it? Now take a really deep breath in. As you inhale, your diaphragm pushes downward, which actually shifts your liver down to meet your fingers. While you're doing this, just press your fingers gently inwards. Keep pressing gently there. So what are you feeling? If it doesn't hurt at all and the area feels soft and springy, kind of like a sponge, awesome, you pass. A healthy liver is naturally soft. But if you're getting a mild pain or a weird tingling, pricking sensation, that's a warning sign. It usually means inflammation. Your liver is tired and swollen. And if you fail, meaning you actually feel a hard spot or a lump, that points to fatty liver or a more severe disease where the organ has gotten rigid. If you're feeling pain or hardness, you definitely want to get that checked out by a doctor.
Moving right along to Section 3, Test 2, the stomach vacuum.
Now, what's really interesting about this next part is we need to talk about visceral fat. And no, we're not talking about the regular belly fat you can pinch with your fingers. Visceral fat is the dangerous hidden fat that tightly wraps around your internal organs, like your liver and your intestines. It is literally the primary culprit behind fatty liver disease. Why? Because it physically squeezes and compresses those liver cells, causing injury and paving the way for really serious conditions like cirrhosis. Let's figure out how much visceral fat might be crowding your liver. Stand up straight and just mirror the breathing technique you see in this animation. First, exhale completely. Push every last bit of air out of your lungs. Done? Okay, now use all your core strength to pull your stomach inward, almost like you're trying to touch your belly button to your spine. Try to hold this tucked-in vacuum position for 20 seconds. You can absolutely take light, shallow breaths for sure, but keep that stomach pulled in tight. Give it a try right now. Okay, how did that go? If you pass, it means your stomach pulled in pretty easily and you managed to hold it for the full 20 seconds. That's a fantastic sign. It means the visceral fat load around your liver is low. Now, a fail is if your stomach felt way too rigid to pull in at all, or if your muscles involuntarily jerked back outward before those 20 seconds were up. Failing this means there's likely a thick layer of visceral fat actively blocking your liver from doing its normal job.
Next up, Section 4, Test 3, the mirror check.
Before you go running to the nearest mirror, we need to quickly talk about something called bilirubin. When your liver cleans your blood, it naturally produces this yellowish substance.
A healthy liver acts like a perfect filter and seamlessly flushes bilirubin right out of your system. But if your liver is sick or struggling to keep up, it can't filter it properly. As a result, this yellow stuff is just left to circulate freely through your bloodstream.
And guess where all that circulating bilirubin eventually ends up showing itself? Right in your eyes. So, the next time you're at a mirror, maybe when you're brushing your teeth tomorrow morning, check the whites of your eyes. Healthy eyes should be super clear and brilliantly white. If you're spotting even a slight yellowish tint in the white part of your eyes, well, that's a direct visual sign that your liver is currently failing to filter bilirubin correctly. And hey, while you're standing at the mirror, stick your tongue out. A healthy person's tongue should look pink and relatively clean. If you see a thick white or light yellow coating all over it, pay attention. In ancient medicine, this is a heavily proven indicator that toxins and waste are building up inside you. Basically, your liver is failing to detoxify, and that internal garbage is literally making an appearance on your tongue, loudly signaling that both your digestion and your liver are in trouble.
All right, Section 5, Test 4, the Wall Sit Challenge. Now you might be wondering, what on earth does testing my leg strength have to do with my liver? Well, think of your body like a highly efficient factory. The food you eat gets turned into glucose to give you energy. Your massive leg muscles are actually designed to absorb a lot of this glucose. But if those leg muscles are weak, they simply can't take it in. So where does all that leftover, unused glucose go? Straight to your liver, where it gets converted into dangerous fat, driving fatty liver disease. This brilliantly illustrates how weak legs often point directly to an overworked liver. Let's put that muscle-liver connection to the test right now. Check out the form in the animation here, and if you can, find a wall. Press your back flat against it, walk your feet out a little, and slide down until your knees are bent at a perfect 90-degree angle. You basically want to look like you're sitting in an invisible chair. Try to hold this pose for 20 seconds. Let's see just how well your body processes energy. All right, time's up. If you passed, it means you held it easily for the 20 seconds without much shaking. That shows you have solid muscle mass, which is actively helping protect your liver. But if you failed, meaning your legs started burning like crazy or shaking violently in just 10 or 15 seconds,
As you can see
it
illustrated
shows your
here,
body
the
is really
skeletal,
struggling to
muscular,
handle
and
glucose
circulatory
properly.
systems all work
Your
in
muscles are
perfect
lacking
harmony.
the necessary energy capacity, and that's a massive red flag that your liver is likely overworked and under-energized.
Finally, Section 6, how to regenerate your liver.
Okay, let's take a breath. If your score across these tests was a little low today, please do not panic, because here's the absolute best news. The liver is the only organ in the human body that can completely rebuild itself into a young, healthy state. I mean, that is a literal superpower. The science clearly shows that if you just give your liver the right environment, it can repair its own damaged cells. Honestly, even if you failed every single test we just did, you can completely reset your liver in just 3 to 6 months.
So, here is the exact science-backed roadmap you can start tomorrow morning for that 3 to 6 month reset. First, kick off your day by drinking warm water with a fresh squeeze of lemon. It acts as a phenomenal, totally natural cleanser for the liver. Second, get out for a brisk 20-minute walk every single day. That's going to activate those big leg muscles we just tested, forcing them to use up excess glucose and taking a huge burden right off your liver. And finally, strictly avoid extra sugars and refined oils. They are absolutely the liver's biggest enemies.
So, I'm curious, how many tests did your silent soldier pass today? Remember your score, maybe try out those 3 daily lifestyle changes, and of course, if you felt any persistent pain during the tests, definitely go consult your doctor. Health is a massive blessing, and if you protect your liver today, it will absolutely protect you tomorrow. But it leaves us with a pretty fascinating thought, doesn't it? If the liver can completely rebuild itself in just a matter of months, what other silent superorgans inside your body are waiting for a total reset right now? Keep exploring, keep testing your limits, and we will catch you in the next explainer.